Greetings to one and all. We, the Team 27, are here to present our solution for the diabetic foot disease as the part of Diatect and Next Hackathon Phase 2. So, the concept map that we have come up is with problem identification, the solution that we have, and the challenges that we faced. How did we overcome that, and the future plans for the same? So, we were discussing about AI-powered screening tool that can be given at every palms of an Indian, making the screening more efficient even at the grassroots level. So, identified there were limited awareness among the doctors and patients about diabetic foot disease, and there is delay in diagnosis. There is psychosocial stigma among the patients to reach the clinicians, and there is lack of specialized portal for diabetic foot. So we proposed an AI powered diagnostics tool. We also created a short video for the diabetic foot assessment, which will educate both the patients and the clinicians. Image based patient education material to overcome the linguistic barriers of India, and the doctor patient portal, and the psychosocial stigma removing patient chat portal where the patients can exchange their information and have their own conversations with the physician and with their co-patients. We face challenges with debugging and API integration with our app. We also found it a little hard to find appropriate and relevant material for our video, and finding relevant examinations and investigations for the same were also little difficult. How did we overcome that? We used a Python 3 Flask based platform for the app development, and the front end was done using Jinja 2 and Bootstrap. The rendering was done on render.com, and the version control is using GitHub. We made a 60-second examination video using Weed AI. This was because we had very limited amount of time. We were much interested in doing it in a clinical based setting with a physician and a patient with diabetic foot disease, but that was one of our limitations. We couldn't access the particular patient or a clinician during the stipulated time that we had. Literature review of significant associating factors along with the diabetic foot disease was also done, and we had listed some of the associated factors that we can be assessed previously. What is our future plan? To make videos for the patient to do self-examination to overcome the inter-user variation due to this camera that the patients will have. So our app basically works upon the principle of self-entry by the patient, where the patient themselves take a picture of their foot, both the foots, and upload it in the particular portal that we have, in which the AI is used to diagnose it or to provide a relevant information about the particular food and alert the patient regarding the condition that he or she is having currently, and to integrate a multilingual large language model in the patient chat platform so that we overcome the linguistic barriers is our future plans. So how did our app develop? This is an overview for us. So the application is Flask based web platform using Python 3. The data management was implemented using Flask SQL Alchemy. The user centric frontend was done using Jinja 2 and Bootstrap as told already. We also used an AI observation specialist called Google Gemini Vision API, and a real time chat system was empowered by Flask Socket IO. The deployment strategy is taken care by render.com, and the project was version control with GitHub as told earlier. So the agenda for this hackathon for our team is to improve AI-powered screening as told. Personalized patient counseling is our other important feature that we have in our mind. So this is one of the papers where we look at the clinical setup in India, how diabetic foot is being managed. About 58% of the physicians, they report that performing comprehensive clinical examination and providing optimal therapy and therapeutic care in the treatment of diabetic foot is actually difficult for them. Only 25.7% of the physicians reported that they are only performing callus removal and changing of the dressings. Other than that, they don't have any futuristic or any appropriate treatment for the management of diabetic foot in their clinical setting. So it became important, and it felt so needful to provide or address this thing through a small video that we have created. So this is a short video used created by VDAI, where we have provided with a small video of foot assessment in diabetic foot disease.
When assessing diabetic foot disease, start with a thorough inspection. Look for deformities like claw toes, bunions, corns, and ulcers. Don't forget to check between the toes for scaling and ingrown nails, and examine the entire sole and top of the foot for dry, cracked skin. Next, test for pulses. Feel for the posterior tibial, dorsalis pedis, and anterior tibial arteries to ensure proper blood flow. Then, assess temperature sensitivity using a hot and cold object. This helps identify early neuropathy. For the fourth step, use a light touch to test sensation at each ball of the toes. comparing both feet for any discrepancies. Finally, check for motor nerve loss by asking the patient to walk on their toes and heels. This comprehensive approach is crucial for effective diabetic foot assessment.
So this video will be useful for the clinicians to remember these simple 5 steps of the diabetic foot examination, and it is easier to apply at clinical setting as well. So this will be an eye-opener for the clinicians who are struggling with the same. So there are some other confounders or the factors associated with diabetic foot disease. One among them is triglyceride glucose index. So based on monitoring these triglyceride levels of the patient, we have a possibility of stating that the patient might develop the diabetic foot disease, and it can be used as a prognostic tool. So this is the clinical characteristic associated with the triglyceride glucose index, and we have very low p-value, which shows that the total cholesterol, LDL cholesterol, HDL cholesterol, and estimated GFR rates being closely related with the diabetic foot disease patients. So the abnormalities in any of these parameters can predispose the patients with diabetes to develop diabetic foot disease. So also we have vascular calcification in diabetic foot being one of the major factors of contributing to the ulcers. So altered calcium homeostasis can show that can predispose the diabetes patients to develop diabetic foot disease, is what has been shown in this paper. Also, diabetic retinopathy is closely associated with the incidence of foot ulcers, was discussed in this paper. So, considering all these factors, we also developed the patient based entry and both the clinician based entry for our app, in which the patient can upload whatever the lifestyle factors that the patient had. If he or she feels that she had consumed something that is high in sugar or something that is unhealthy, the patient can document that. Patient can upload about his or her smoking status without having to face any of the stigma in the clinical settings. Also the picture of the foot without him or her going to the clinic and showing that to a clinician or any other people. He or she can do it at her home based thing. So that is one good thing. And also the clinician based entry, whatever the clinician is examining or clinician is inspecting and finding, if there is any erythema of the foot, if there is any scaling of the toes, if there is any other deformities seen, ulcers or callus, anything that the clinician monitors, and the investigations done by the clinician at the bedside can also be documented. So diabetic retinopathy is classically it's detected by fundoscopy, and we have the symptoms like blurred vision, fluctuating visions, and vision loss, which the patient will present. Coming to the tragic rule of 15 in diabetic foot ulcers, 15% of the diabetic patients develop ulcers, and 15% of those patients who develop diabetic foot ulcers will develop osteomyelitis as a secondary infection. And among those people who develop 15% of the people who develop diabetic foot ulcers, they have to face their consequences like amputations. What is the tragic rule of 50? It is after amputation. The amputation is about 50% of the people have to undergo transtibial or transfemoral amputations, with BKA amputations. And among these patients who undergo amputations, 50% of them require second amputation within the span of 5 years, and among them 50% of the people die, showing that there's high mortality if amputation is occurring for diabetic foot ulcer patient. We also overcome across a paper which states that the awareness and practice scores among these patients with diabetic foot disease is actually low in an Indian setting, especially in South India. The practice scores of this patient were about 41.6% among the participants who took part in the study. So we felt a dire need to develop a image based awareness posters for the patient, and that we have come across that thing also. So this is a simplistic solution, might be overlooked by most of the teams, but we tried to include that as well. So implementing such posters in each and every PHCs in urban primary healthcare centers and tertiary hospitals as well will definitely improve the knowledge of the patients, what to do, what exactly to actually look for in diabetic foot, and how to take care of the foot, instead of just going around with lots and lots of text. It is important to show them visually, so that we'll be able to overcome the linguistic barrier that we have in our country, especially in India. So this is the app that we were talking about. This is the user interface. It is the high fidelity prototype that we have currently. So we have the doctor dashboard, where the doctor will be alerted about all the patients who are registered in his or her portal. There is also every other details, like the lab results that we were discussing: HbA1c, fasting plasma glucose, the lipid profile panel, and the kidney function tests, and the clinical findings of the patient comes with, and the doctor monitors. That can be documented by the doctor in this app. This is actually usable in PHC setup as well, works well in a mobile. Then we have the clinical findings as such, as we have told earlier, the fundoscopy findings like macular edema, foot inspection finding by the clinicians, such as skin changes like erythema or discoloration, or signs of infection or dryness or clawing of toes, and also the description of ulcer if an ulcer is present in the foot. Additional doctor notes includes other investigations like ankle breaker pressure index, monofilament test, and durometer that can be done if present in a PHC. Okay, so this is the self-reported entries part by the patient, where the patient can actually upload his or her foot image along with the other lifestyle factors like smoking, alcohol, or exercise, and allow the AI to make an opinion about his or her foot ulcer, so that he or she is intimated and provided with a time span which she or he should go to the hospital or PHC to a clinician. So in this particular page, the patient is being alerted about the self-reported entries that she can do, the number of entries that he or she had did. If the patient has a point of care glucose testing device, or if she is aware of self-monitoring of blood glucose, he or she can also upload her own random blood glucose levels and other things as well. So this is how a new patient data entry part looks like, where the patient can enter the lifestyle factors and the blood sugar if he or she has monitored, and upload his or her foot image without having to worry about any of the psychosocial stigma, any of the thing that he or she has to face to overcome the social factors. Being at her home, being at a comfortable place, he or she can upload their pictures and let the clinician know about her condition. So this information is shared among the clinician and the patient will also know about the condition of the foot ulcer based on the AI opinion that is being given. So along with that, we have the lifestyle factors and additional notes, or any concerns that the patient has will be intimated to the physician, and the physician will also be little free of the load of patients in India, as we see a lot of patients are coming to PHCs, and it's becoming a lot of trouble for the physicians to handle with proper time. So this will actually provide them a relief, because they can actually include all the investigations and update the data about the patient wherever they are free, without having to see the patient at all. And once the patient is being alerted about the AI, about the foot ulcer by the AI, the patient will be coming to the clinic, and the clinician will be able to schedule an appointment according to that. So this is how a patient profile looks. There is doctor visit entries. Almost the recent 10 doctor visit entries will be shown in the front page, and patient self-reported entries will be shown in the other end. So based on this, the clinician will be able to come up with a proper for the treatment plan, and the patient will also feel confident because he or she is also playing a role in this particular treatment, and he or she will be felt that they are heard properly. So this is the patient group chat aspect, where we have developed a chat room where the similar patients with diabetic foot disease will be able to chat and share their concerns among themselves. We also have the physician being here to clear any of their doubts, so that the patients will be able to understand what is going on. So this patient chat room will be mostly applicable to the patients registered to a particular doctor, so that a doctor who's seeing all these diabetic foot disease or any amount of patients with this particular condition will be able to share their concerns with the physicians without having the worry to go to the particular hospital. So our concept was simple: chart group, A about screening, self-entry with the patients and visual aids, and we have did a particular cost analysis and the timeline of this thing. So the technology that we have used for the app development, the backend consisted of Python 3 and Flask. Front end consisted of Jinja 2 templating and Bootstrap 5, Flask WTF. Role-based architecture was framed. Every user has a particular role. We have patients to upload images and view reports, doctors to view cases, annotate the findings, and they can also chat with patients, as we discussed earlier. Admins are there for the app to regulate the user management and system settings, and authentication is based on role-based access control. The integration with AI is the overturning factor that we have. The image-based observations are made by the Google Gemini Vision API. It detects ulcers, callus counts, bunions, fissures, scaling between the toes, and deformities. It's very simple to use as well. The patient can upload their foot image. They are instructed by the clinician how to take a particular picture, and the knowledge about that will be provided in PHCs. That's the next future plan, to educate the clinicians about taking pictures, and the patients, once they know how to do that, once they upload it, the AI will analyze it and interpret and provide the insights on the same. There is also real-time communication aspect. The chat room empowered by Flask, Socket IO, version control and deployment is taken care by render.com and GitHub. So this is a rough cost analysis of our project, including the app development, API subscription, mobile app development, and annual maintenance, visual aids, doctor-patient entry features, and also the administrative cost, including all other things in our project, comes up to 70 lakh Indian rupees. So this is something that we can actually scale it in the future as well. So is it feasible clinically? Yes, it is, because the initial reach that we are aiming for is about 1% of the diabetic population in our country. India has a wide range of people with diabetes. It's roughly about 21 crores of people with diabetes, and we are targeting at least 1% of this population, which is about 21 lakh people. The deployment cost of our project, as discussed earlier, is 70 lakh rupees. Cost per patient, if we look at that, 70 lakh rupees per 21 lakhs of patients that we're aiming for, it comes up to 3.34 rupees for this project to take over for the diabetic foot disease thing. Is it scalable? Yes, because the cost will drop as the users will increase. As we know, operation cost will be shared as public private partnership or government support comes into play. The benefits of this project is that it has a low initial cost and it has low future cost as well. It is scalable for grassroots diabetic care, because most of the Indian rural Indians are also empowered with smartphones by the government. So it is actually easy to use and it is feasible clinically. As we discussed earlier, future scaling, the per patient cost will decrease significantly as the project scales, because operational costs will be shared among more users. And once PPP comes into play, they will actually subsidize some of the cost, and it will empower the people in the rural areas and people with low access to technology to take care of, to take use of this, make use of this project. We would like to sincerely thank the Department of Endocrinology of CMC Vellore and our diabetic nurse educators, Mrs. Bharati, Mrs. Sunita, Mrs. Ruth Walina, for their work in providing the images of the food so that we can train our artificial intelligence model. And we would also like to thank Mr. Mahandeep Parida from IIT Madras, who has been one of our important teammate who's been behind this app development. Would like to thank Mr. Gopal Krishna Mishra, Ms. Nisha, and myself, Manuel Inbam. Signing off. Thank you for listening. I hope this is something that we can look up in the future. Thank you.